Hi, you guys. This is Evelyn. I wanted to read you a letter I wrote. It was my exit statement, actually, when I left my job of 25 years. And I wanted to share it with you because there's a lot that I went through at my job. I worked at University of Penn Hospital, and this is not to diss the hospital I was working for. I had many people I worked with who were just amazing doctors and nurses and techs and all that kind of thing. My main problem was with employee health and the way they treat you when you use your disability. I had gone through a back injury at work, and then I ended up having a concussion outside of work as well a couple of years after that. So this is my letter, and I hope you find some value in it, and let me know if you do, okay? So it was called Mission Statement, the things we think and do not say, the future of our business, which of course you all know is from Jerry Maguire. If I were to ask you to tell me your greatest wish for our world, you would probably answer world peace, peace of mind, security, health, wealth, and happiness, or no more anger, violence, and abuse of power. Well, how about just love? Doesn't that encompass all of the above? And isn't it simple enough to apply to the most uneducated, overeducated, impoverished, and wealthy? Since the world can be such an overwhelming place to start, how about if we start with ourselves, then our families and friends, and then our workplace? I love myself. I love my family and friends. My workplace. I don't think most would fill in that blank with love. But we work in a hospital. Shouldn't that be the one place filled with love? We're born there, we die there, we save people there, and people save us when we can't save ourselves. We see love there every day between the employees and their patients, not always perfect and not always sincere, but still always there. However, it's become increasingly evident that rules, regulations, and the fear of lawsuits have become more important than doing the right thing. Passing the buck has become the norm instead of passing information back and forth. To solve a problem, to cure a patient, to think about the responsibility of one's thoughts and actions. There is a constant state of suppressed fear in our environment. Fear of hurting or killing someone if a human mistake is made. Fear that we're not smart enough, not talented enough, not consistent enough to do the job well every day. After all, there are lives at stake. Isn't that more of a reason to put more emphasis on teaching and holding back on the judgments and criticisms? Isn't that more of a reason to support each other, to catch each other, rather than be angry at them for not being perfect that day? In fear, there is no love, and in love, there is no fear. Employees get angry when they see their bosses as cold, mean, or detached, when they ignore their hello in the hallway. They don't see that their boss has the weight of the world upon their shoulders. And in the same breath, the boss need not abuse their power for the sake of superiority. They cannot perform without their support staff. No one is really more important than the other. The human machine only works perfectly when they work as a perfect team. Yes, at times, the weakest link will need to go, and they may go off and become a famous painter or a star teacher in West Philadelphia. One of the best on the team may die suddenly in their 20s and leave a job that they adored. Have we forgotten that she was an example for us? Have we not forsaken her? Why does the hospital not care when an inpatient's glasses were lost and they cannot afford a new pair? That his wife came to pick him up on crutches right after being discharged herself? That in his 70s he is still cutting lawns for money and needs to get by? That he is still sad that he was placed in a trash can at birth? I teared up when this sweet, disheveled, odd couple greeted each other at the door in a passionate, loving embrace. It had taken him a bit to let me in, and he had been in and out of homes and in trouble a lot as a teen. It was not easy for him to trust. I feel honored that he trusted me. I sent him some cash from the North Pole for a new pair of glasses, but unfortunately it ended up being a small token sent to a widow. I am not singing my own praises, as there are many others who secretly and openly do much more and many more wonderful things in the name of charity, simply giving an example of what I hope others may emulate. Why do we reward power and control and not love? I ended up at Penn because I had just had my first child and I didn't want to go back to my job at an accounting firm where my boss thought I was being an emotional female. I had insisted he move me to another area while they built a wall right in front of my desk when I was 6 months pregnant. He refused to let me open the window because he was obese and required air conditioning even though it wasn't really hot outside. Meanwhile, his cousin, his more silent partner's son, a wonderful, funny young man who also worked there as a CPA, had dumping syndrome and a third of his stomach left. My boss docked his pay one day when he called out sick. Gary died in his 20s, shortly after his wife worked the photo booth at my wedding that year. The saddest funeral ever, with his 3 young children standing over his grave in a huge crowd. He may not have been shown love by his cousin, but he was very loved by everyone else. Anyway, I started at Penn in January 1991 as a subcontractor in IR for SCVIR and the Contrast Registry. I was the first official research coordinator. A nurse had been trying to keep up with the data collection, but had not been sending it to Boston using the computer, and apparently my father fought another parent in research admin and won my contract. Since I came from a business background, I had a lot to learn. I had a training day and then harassed my father, and he was happy to be harassed. There were also new doctors on staff and fellows that also helped me out that year. They would help me out at times. I read thousands of inpatient charts on the floors, and after 9 months started the STAR registry for lower extremity PTA. I learned a lot about the vascular lab as well. Henry was our secretary, and one interesting person he was. He told me he was a professor, had been married, and had a daughter from which he was estranged. He had converted to Judaism and then was in a homosexual relationship and wrote a book about it, but his partner wouldn't let him publish it. He ran into his father 5 years after his mother had told him that he had died, and then poor Henry died at home, maybe depressed about his long friendship with a married female his daughter's age, or maybe it was about his failed relationship with his daughter. He didn't show up for work for 3 days. He was alive at home when we first called, or was first found by his friend, but then died soon after, shutting everyone out from what I recall. He was always helpful and loving, and it was an honor to have known him. On July 6, 1992, I became an employee of HUP and managed and or coordinated over 50 prospective industry in-house and NIH studies over the past 25 years, working closely with some of the top interventional and diagnostic radiologists and surgeons in the world, as well as doctors from pulmonary medicine, critical care, trauma, and oncology. I'll never forget Dr. John Pryor, who lost his life serving in Iraq. He was such a positive, good man and a pleasure to work with. Although I only worked with him for a short time, I felt his loss greatly and felt honored to have known him. These are some of the moments I remember most, the people who stood out because they were kind, loving, and generous with their time and their knowledge. Unfortunately, things have changed. Money is tighter and there's less caring, not so much because people don't care, but because people don't have time to care. Doctors are forced to see too many patients. There is no follow-up or collaboration between physicians. One doctor rules out their specialty and passes the patient along to someone else. Oncologists discharge patients to die. They are not permitted to inform their patients that there are alternative treatments to chemotherapy and cures that are not FDA approved because there is no profit in it, or that you can't patent something that is natural, or that curing cancer would be the downfall of our market. I've received many emails recently requesting that I complete a questionnaire on how my experience was at UPHS. I have not returned them because what I need to say would not have been captured by your questionnaire. My personal experience at Penn. Most of my experience with outpatient radiology has been a good one. Other than having to wait too long for MRIs, hours multiple times, in general the techs were lovely. My first significant experience as a patient at Penn was ruling out a clot event to my pinky back in 1997. I had a purple lesion on my outer pinky after what felt like a bee sting while getting milk out of the refrigerator at home. When I saw my dad at work, I was reminded to tell him that I thought I had thrown a clot, and I felt the rebound up my arm. When he checked my pinky, it had turned purple. He sent me to the vascular lab where my pinky was flatlined. I then had an MRI and then angiogram with contrast reaction. I was treated very well by my radiology and vascular lab friends. I was admitted on heparin and I passed out getting up to walk to the bathroom. My complaints are, number one, when the cardiology team rounded, residents I knew from work surrounded my bed while I struggled to keep my gown up when the cardiologist was listening to my heart. The female I knew looked away because she could see how uncomfortable I was. I received a small note with a flower from the hospital apologizing. My angiogram reported no clot. However, it did not report that the capillary at the injury location was missing amongst a perfect array around the tip of my pinky. Number three, I also did not understand why I couldn't read my chart without a doctor present, even though I read charts there for a living. I understand insurance risk, but if I am paying someone to invade my privacy and document things about my body, I have the right to see them if I am able to understand what I am reading. On 12/10/13, while my office was displaced to 5 Gates, I slipped on the Gates steps on my way to IR. There was a very bad snowstorm that day, and a lot of snow had been tracked in since the steps were near the Gates entrance. I had bruised my pelvis badly and jammed my right back into my waist, as well as minor bruising to my upper arm that had blocked the rail on the way down. I felt like the wind was knocked out of me when I stood up, and I warned the security guard out of concern for patients that could also fall. For a moment there, I had a little trouble straightening up, so out of concern, he wrote my name down. I'd gone back to my office and realized that I'm supposed to tell my supervisor about my fall, so I did, and she sent me to occupational health. I thought after a couple of days I'd be fine. I didn't want to be a problematic employee and complain, but after limping for a few weeks, early January I got my period and I couldn't twist without severe pain in the area between my right SI joint, which was the injury site, and my right hip. I couldn't get up off the couch. It was very painful. At the time, I knew nothing about back injuries and very little about back and pelvis anatomy. What I did know is that people had warned me that I'd be treated like a criminal if I needed to use my workers' compensation, so I tried to follow their instructions without complaining. They sent me to a PT in January and told me I could see a chiropractor, but that they don't pay for them, which was a lie. I had heard some scary stories about chiropractors, so again, I was a good employee and followed their instructions. I requested and was refused imaging of my back and pelvis at each visit. They finally allowed me imaging in February, but refused to image my pelvis since they insisted that my hip pain causing the limping was just referred pain from my lumbar sprain. I didn't understand and felt helpless. I saw doctor number 1, and this was employee health. This is the only one I really have an issue with. I saw doctor number 1 twice. He dismissed my input and said that my mid-spine burning and process sticking out into the chair had nothing to do with my fall, whereas my PT had spent a lot of time trying to roll it back into alignment. My sacrum was also protruding and puffy most of the time, and this doctor number 1 was being very antiquated and treated me like a silly woman. He suggested that I start my jogging again when I couldn't even walk a full stride yet. Doctor number 2 wrote him a letter of his disagreement regarding the jogging. Doctor number 1 also said that my pelvic malalignment was insignificant. Doctor number 2 agreed that it might help to work on this, but wanted to wait a while as not to cause more problems. When I eventually saw Doctor number 3 in November, he said of course the pelvic malalignment would affect my recovery, and was the first to really manipulate my back and pelvis to see what was going on. By this time I had done a lot of my own research since I was on my back every day trying to recover with ice, Motrin, exercises, and stretches. I noticed that my left shin was slightly longer than my right, so I tried an insert a couple of times with failure because it bothered me too much. However, when I tried again in November, it felt okay and ultimately did help me straighten out my alignment. Due to limping for the first 3 months after my injury with no time off, I developed and continued to have left referred pain into my left leg as well as bilateral hip pain, tendinitis, bursitis, constant buttock muscle spasms, pain, and SI joint pain in addition to the burning in my mid-spine and sacrum and upper back at times. I also had fluid in 4 sets of facets in my thoracic spine, as well as another bulge not documented until September of 14 in my thoracic spine MRI report. I was in pain every day at work for 7 months. No one told me to take any time off to heal. As a matter of fact, I took 2 vacation days because it was becoming increasingly difficult to work, and I was worried that if I took sick time, it may lead to being written out if I had to call out repeatedly. Because I could walk, although I was limping, I could touch my toes and walk on my toes and heels at my office visits. I was told it was just a lumbar sprain and that I did not need imaging, even though I requested imaging every time. When I said I needed pelvis imaging, I was told it was just referred pain from my lumbar sprain. So because I wanted to believe that they know best because they see back injuries all the time, I did what they told me to do. I was worried that if I had an MRI, that my insurance would defer back to my work injury, and they had refused it. So occupational medicine said I was not allowed to have imaging, so they were refusing payment as well. If I had tried to have one outside of that, they wouldn't have paid either because it would have deferred back to my occupational medicine injury. We are told we are required to see occupational medicine for 3 months. We're not allowed to go outside for the injury. We have to see occupational medicine for 3 months. When they finally referred me to another doctor just prior to 3 months, I was informed that I'd have to see a pen doctor even though there were no pen orthopedists near my home. Since I was still having trouble walking, I did not want to go into Center City, so the MP said that I could see Doctor number 2 in sports medicine, who is the doctor to one of the sports teams, and just across the street. He continued my PT, which helped somewhat, but was not resolving my problems. He said I could see a chiropractor, but to find one through a referral. He was going to refer me to the chiropractor that the professional sports team he knew used, but then he changed his mind after that. I saw a chiropractor who helped greatly in relieving pain with massage and lumbar traction so I could continue to work. I tried a spine injection through doctor number 3, as well, which did not help. Disability stopped my coverage for the chiropractor, and then my PT discharged me because I had reached a plateau and he knew I could continue exercises and more research at home, that I was helping myself more than PT. I then found an Atlas chiropractor. They use vibrational tools to gently manipulate the neck and then work their way down. It is because of him and my own research that my sacrum is now straight and thus resolving my butt and thigh muscle spasms as well as referred pain. My inversion table resolved most of my hip pain on the first try a year after my initial injury. I still get a little tendinitis from time to time, but no more constant pain in my hips there. The small, soft insert in my shoe helped my sacrum straighten out, and I no longer needed to keep it in to keep my hips even. I don't understand why radiologists are not required to report scar tissue. I incidentally decided on lipo to correct a cool sculpt treatment. The lipo broke through the scar tissue, most likely from my C-section, and I literally felt my hip drop when doing some psoas release massage, which spontaneously lessened my leg length discrepancy. To say that any of my mild spine degeneration is typical for my age is not taking into consideration that I have never been physically typical of my age. I've always been active, athletic, and healthy, and had a recent special CT that even states that I am above average for my age and actually have no plaque anywhere in my body. These simple things are sometimes the answer to our problems, like my vitamin D deficiency that no one diagnosed. My neighbor and I did, that caused years of spontaneous clotting in my fingers and toes. I had many tests, contrast I didn't need, etc. over 15 years because I didn't have a complete vitamin assessment. This can cause breakdown of vessels, malabsorption of calcium. I now have many small renal stones per Dr. Harvey Eisenberg's special diagnostic CT. He's a friend of the family, along with the other spinal issues that I had. In my opinion, all employees who work full-time inside a hospital should be required to have a vitamin D assessment. My daughter lived at the time in Arizona and had spent a lot of time outside and yet still was deficient in vitamin D, B12, and iron. In my opinion, all acute back injuries should be treated by an Atlas chiropractor within 48 hours, which is in the literature, and a week off to heal the acute injury. If continues, massage to loosen the muscles so that the alignment can then correct, and then if pain continues, PT would be in order to reset the muscle. Lots of ice to keep the swelling down with limited heat as per PT, MD, or DC, and to try the inversion table for 5 minutes if needed to see if it helps, if it's okay with your MD or DC. Even though I'm offering this information in good faith, I'm sure you will all dismiss it since it is not quote-unquote proven, and this is a shame. In the ER for my concussion CT, the attending told me one thing and the resident did another. Also, the attending scolded me for trying to go back to work after a concussion, and then the resident was going to discharge me to go back to work on Monday. I was left alone in the hallway for 5 hours, in and out of sleeping in the middle of the day, and the summary of my problem was incomplete. The only doctor that did any real concussion testing was Dr. number 2, who would have been interested in seeing the difference in his tests since my ER visit, and in my opinion, walking 3 steps on a line and checking my eye and eye-hand reaction time is insufficient concussion workup. The ER should obtain Dr. number 2's standard assessment. My overall experience as an employee leaving Penn, the exit interview I was never offered, is that I worked hard for 25 years with top ratings, tried to do 8 hours of work in 6 hours while on disability as to not let any of my associates down, and I pushed it to 7 hours even though I had always had pain even at 4 hours, if that, it was probably less than that, only to leave feeling pushed out because I couldn't possibly do the same job I had done for 25 years from a block away from the hospital, which now they were pushing my office outside of the hospital. And then losing out on my sick time payout because an old woman who couldn't see ran me down jogging with subsequent time off work. So even though I had 960 hours of sick time for many years, I now would have to work another few years to get back to 960 hours because they don't pay unless you have all of the hours complete. So they don't pay your sick time out unless you have that 960 hours. And so, of course, I did not accumulate sick time. There were many years that I did not accumulate sick time because I was capped, because I was already at 960 hours. If I had slammed my head on the street a few years ago, I'd definitely have 960 hours this year at early retirement. I can't say that this left a good taste in my mouth. This is money I earned and that my family deserved. I also have a pending court case in September so that Penn can try to prove that I'm no longer injured under my back injury, so that they don't have to pay anymore, even though my MRIs show 5 bulges, 2 of which touch the nerve bases. The Penn insurance orthopedist who looked at me for 5 to 10 minutes and reported I had fully recovered is the one who should be questioned, and your lawyer was abusive. I was your patient and your employee, and Penn chose to abuse me at a deposition when I still had residual concussion issues and proof of my back injury. I should not have been treated like a criminal. I had been injured while working and used my workers' compensation. Isn't that what it's there for? I may have burning in my spine for the rest of my life, per Dr. Number 3. I am a good person, and so why am I being treated this way? The first time I called the Penn contact for my injury, she didn't say hello. She spoke down to me in a nasty tone and said, "Who do you think you are, going to see a chiropractor?" I continued to work hard at recovering my back and my concussion. Thank you for the lovely CD from your detectives of me on my jog, going to Home Depot and placing some flowers in my garden so that I have something nice to view. It was the one day this year I was actually able to get something significant done outside of my house, and of course I paid for it with more pain that week. Please let me know next time so I can wear pants that are more flattering. I come from a place of wanting to see improvements in the Penn system and more love. Energy out is returned in kind. Respectfully and with love, Evelyn Stainthorpe. The key to this business is personal relationships. The answer was fewer clients, less money, more attention, caring for them. And of course you all know that was from Jerry Maguire's mission statement in the movie Jerry Maguire. Rise and be love.